Many people on GLPs are told not to eat certain foods, but are not necessarily educated on what to eat. So it's important to look at food that helps build muscle, supports metabolism, helps the gut-brain immune axis, and avoids nutrient deficiencies, because we don't want muscle or bone loss and we don't want permanent gastric damage. The microbiome is extremely dynamic, powerful, but also sensitive to food, the environment, supplements, hormones. So if we're taking a GLP, such as Wegovy, Ozempic, or even a tirzepatide, which is Mounjaro or Zepbound, we gotta be careful. We gotta know how we're eating, because that influences our gut. So let's talk about what are the best plant-based foods for your gut on GLPs. I'm Dr. Melissa, an integrative doctor who's going to give you the evidence and break down how to pick your healthy foods on GLPs. So I know you've been probably thinking you've been eating healthy. I know you've been trying all sorts of ways to stay strong and maybe even trying different diets and meal plans. But being on a GLP is quite unique and different, because it's not just about avoiding the side effects such as nausea, vomiting, diarrhea, constipation, but also avoiding scary things such as hair loss, bone loss, even dizziness or fatigue. So GLPs work to increase your fullness factor and decrease your portion sizes. So the brain tells the gut that it wants less food, so you gotta give it less. And so that means smaller portions, and also looking out for not just the food intake, but the liquid intake. If you're having large amounts of water or other types of drinks, you probably won't have much room for your food. Try to take your liquids separately from when you're eating. You can take it up to half an hour or an hour before eating, or even half an hour to 1 hour after eating. It's important to eat slow while on GLPs. You don't want to rush your eating, because sometimes you won't be able to enjoy your food. And when you're eating, you want to focus on higher protein, and we're going to talk about that in this video. It can be very difficult the first few months when getting on a GLP. You're going to have to change your lifestyle and be conscious of what you're eating and also how much. And then again, when your dose changes, there is an adaptation transition period. Number one, protein and more protein. Proteins can be at the start of every meal, and it can be in the form of nuts, seeds, yogurt, and even things like tofu or kefir. A helpful target when on a GLP is to aim for 20 to 30 grams of protein per meal. If you think of breakfast, you can think about adding a half a cup of edamame or half a cup of tofu. If you really enjoy tofu, why not add a full cup? I know it may sound strange, but you can have it on the side or put it in your smoothie, and then add a scoop of plant-based protein in your smoothie as well. At times, being on a GLP decreases the appetite so much that maybe you may want to skip breakfast. I know that can be very tempting because you think you're fasting and you want to have less calories, but you actually need healthy nutrients in your body. So try not to skip out on breakfast and have something light. You can go for a light oatmeal, a light yogurt. You can even go for some soups that are soothing for your gut. The softer liquid items may be more easily digested, and there will be a less chance of you developing nausea and vomiting. Foods to be very cautious about when on a GLP, especially in that morning time, are foods that are highly processed. So yes, avoid that plant-based burger. Don't want those heavy plant-based sausages necessary unless it's a small amount. Some people are still eating their bacon and their turkey, so that's the time I would ditch it or eat a lot less. Either choose eggs or the turkey, but I wouldn't do both. And be mindful, if you are a bean lover for the morning, do a little bit less. If it's lentils or beans, try to not overdo it all at once. If you're in a rush, protein bars may be something you gravitate towards too, but watch out, look at the labels, because once again, you're just adding more sugar and you're giving your gut and the medication a harder time. The goal is to reduce your insulin resistance so that not only you can lose the weight, improve your fatty liver, and improve your overall health. Now I want to pause here for a moment because I see a lot of patients that I treat who are on GLPs. They maybe tried it in the past, they gave it up after a couple months, and it just caused them all these negative side effects. The nausea, the fatigue, they just couldn't handle it. I wouldn't blame the medication itself here. I always look at the whole picture. Small portions, good amount of nutrients, and portion sizes is important. Number 2, don't ditch the vegetables. I have a lot of patients who are formerly plant-based and they were scared to eat vegetables or their salads and they were overwhelmed. It's important to know that you can have your salads. You can have vegetables. Sometimes you may want to cook them. Sometimes you may want to steam it or roast it in the oven. Use an air fryer. I do love having oil in the form of healthy oil, such as olive oil, and cooking my vegetables on a skillet. Some better tolerated vegetables in case you are feeling agitated in your gut are zucchini, carrots, squash, green beans, and mushrooms. Get creative and don't get overwhelmed because this is totally possible. Try things one step at a time. A good starting point for vegetables, especially cooked vegetables, are 1/2 cup to 1 cup a meal. I do love actually a little bit more. I love 1 to 3 cups of vegetables in my meals. But if you're thinking about vegetables for lunch and dinner, make sure you have variety. Remember, this is key. All your beautiful greens have antioxidants, magnesium, zinc, all these things that help grow your hair. And then remember, broccoli has amazing amounts of calcium that help build bone. And I love my mushrooms because it does have some vitamin B12. And if you aren't all 100% plant-based, then you can get fish and other things that are high in zinc, magnesium, and other minerals and vitamins. It's important to get a good amount of fiber in your gut or else it will worsen your constipation. My patients who on our GLPs have regular bowel movements if they're eating plant-based. But I want to let you know you can have a healthy bowel movement when on a GLP. As your tolerance improves on certain vegetables and on certain amounts, you can slowly go up. But definitely I would cut down at least half the amount what you're used to eating before starting this medication, because then your body, your brain, and your gut can get used to eating smaller portions. Number 3, carbohydrates. How much is enough? Don't be scared of carbs, but don't forget we want some good, healthy, complex carbs. Carbohydrates play such an important role on thyroid health, hormone health, and overall metabolism. You need this for your energy, for your mitochondria. You need this to feel energy and avoid fatigue. So don't skip out on your healthy carbs. I do love sweet potato, and I recommend at least 1/2 cup of that. Sweet potatoes are great because it's already sweet and it has a nice soft chew. And don't be afraid of cooked oatmeal, and you can also get 1/2 cup. Add your favorite berries, which is another healthy carb. Raspberries, blueberries, even strawberries. I do love my brown rice, and you can do 1/2 cup of that at lunch or dinner so that you have these healthy whole grains with minerals and phytonutrients that actually help your whole body. Some people like quinoa or buckwheat, and you can do 1/4 to 1/3 cup of that. It's softer, it's a different way of getting your carbs, and it's something that you can easily digest. So when you're making your plate, don't forget, not only do you have a healthy protein, you have healthy whole grains. And then that allows you to balance the sugar spikes and not have that craving that you are used to having. Number 4, healthy plant fats are still an option. Safer fat portion options are going to be nut butter and tahini, and you can have 1 tablespoon per meal or per day, depending on your needs and activity. I do love 1 tablespoon of flaxseed or chia seed, even 2 tablespoons if you have high blood pressure. Now, olive oil is great. You can put it on your salad, you can put it in your cooked meals, and you can use 1 or 2 teaspoons at a time. Avocado, I think, is just wonderful because you can not only make an avocado toast, you can chop it up and put it on your salad. I chop it up and put it in a smoothie. With soy milk, it's a nice avocado shake. Or you can put avocado in a nice, beautiful dark chocolate pudding, as one of my recipes show in the past. Now, it's important to avoid certain fats early on when on tirzepatide or Ozempic or semaglutide. You want to avoid fried, greasy, oily foods, but even vegan substitutes such as cheese, non-dairy cheese, and those heavy creams, because that can be not only very filling for you, but that can cause extra nausea. Another thing you can avoid is large servings of nuts. And I know that's a big temptation because we love the crunch, we love the salt, and we just want to eat like it's popcorn. But when it comes to nuts, they're not only high in calorie, but high in fat. And the body can only process so much of it at one time. And that's going to agitate your gut, especially on a GLP if you have high amounts of fat. Make sure you reduce it and just go up to 1 or 2 pieces at a time rather than handfuls. Number 5, here are gut soothing foods for your gut on GLPs. There are certain liquids that can help soothe the gut. And one of my favorites are just having some ginger teas. You can cut up some ginger and steam it in water, or you can get a pre-made ginger tea. Having ginger is important, especially if you have nausea. So if you eat something and you're feeling extra full in your upper chest, that's because the food is stuck in your stomach. And you want the sphincters to open up and relax and allow that food to move down. On a GLP, you can have ginger 1, 2, even 3 times a day. It helps the digestion move faster to avoid that nausea and even some constipation. Now, I do love peppermint because not only does it help with GERD-like symptoms or reflux, but it also helps with abdominal spasms. Some people who have IBS, or if they are having issues of constipation, you want to be able to open up the intestines so that you can have a good, healthy bowel movement. Here are other gut-soothing foods and liquids for you. You can add 1 cup of miso broth when you have your lunch and dinner. Miso soup is so soothing for the gut, and it can help when you're having symptoms of nausea. Oat porridge is always going to be good, or some type of rice porridge, because it's soothing for the gut as well, and you can have half a cup of that. Now, don't forget your fermented foods. You could have kimchi in a tortilla, or you can have sauerkraut with your crackers. So aim at least for 1 to 2 tablespoons of fermented foods for good, healthy probiotics. Now, I do love soy yogurt, any type of plant-based yogurt. And this is good, 1/4 to half a cup for breakfast or even snacks. Now, here's a hydration tip. If you absolutely need some fluids during your meals, have little sips. Try not to have big gulps and finish 1, 2, 3 cups during your meal, because it probably won't even be possible. Number 6, I often get the question, how often can I eat? When on a GLP, you want to be able to bring rhythm and routine to your gut. You want to have at least 2 healthy meals, up to 3 healthy meals, and then 1 snack in between. Don't starve yourself. That's why I want to encourage you by eating 2 to 3 times a day and having a healthy snack, such as healthy fruit, healthy vegetables, or you can have some hummus with a healthy cracker. Here's some bonus content. Let's dig into the research and the science. So the American College of Lifestyle Medicine and the American Society of Nutrition has a joint advisory scientific paper that they put out that breaks it all down, why it's important to look at healthy nutritional foods during the process. It's also important to screen for things such as muscle mass, eating disorders. It's important to understand one's comorbidities and not forget hydration, healthy nutrient foods, and getting support. You may need a lifestyle integrative doctor, also a dietitian, to get you through the details. For some people, it's important for them to track their food through special apps, through journaling, or just being accountable with their provider. You also don't want to forget the other lifestyle medicine pillars, such as stress management, sleep, exercise, and avoiding toxins. If you're still smoking and having heavy alcohol use, you're not going to feel good on this medication, because alcohol has high amounts of sugar, and that will just make you crash and will mitigate the impact of the medication. Remember, these medications change hunger, metabolism, and your overall health, and it can be a game changer, but you also need nutrition too. If you want to hear more, follow me, subscribe, like, turn on your notifications, because I got some good content coming your way.